Fungal nail infections, what they are and how to treat them. Understanding fungal nail infections, onychomycosis. Fungal nail infections, medically known as onychomycosis or tinea unguium, are common conditions that affect the toenails more frequently than fingernails. These infections develop when fungi or yeast invade the nail structure, often progressing gradually over time. What causes a fungal nail infection? Fungal nail infections thrive in warm, moist environments. Common sources of exposure include communal areas such as swimming pools, public showers, and changing rooms, as well as prolonged use of tight or non-breathable footwear. Certain individuals are at higher risk, including older adults, people with diabetes, HIV, or other conditions affecting the immune system, individuals with a history of athlete's foot or ringworm, those with nail trauma or poor circulation. Signs and symptoms. Typical symptoms include thickened or brittle nails, discoloration, often white, yellow, or brown, distorted nail shape, a slight odor in some cases, separation of the nail from the nail bed in advanced cases, discomfort or pain, particularly when pressure is applied. Types of fungal nail infections. There are several types of fungal nail infections, each with distinct characteristics. Distal or lateral subungual onychomycosis. The most common form, beginning at the edges of the nail and moving inward. Nails may become yellow and lift from the nail bed. White superficial onychomycosis appears as white powdery patches on the nail surface, gradually leading to surface degradation. Proximal subungual onychomycosis, a rarer form often seen in individuals with weakened immune systems. It starts at the base of the nail and progresses outward. Candidal onychomycosis, caused by yeast and often associated with trauma to the nail. It may lead to redness, swelling, and detachment of the nail. Diagnosis. Diagnosis typically begins with a clinical examination and discussion of your medical history and lifestyle. In some cases, a small sample of the nail may be taken for laboratory analysis to confirm the specific type of infection. Treatment options. Initial stages may respond well to topical treatments such as antifungal lacquers, e.g. amorolfine. In more advanced cases involving nail thickening or discomfort, oral antifungal medication may be prescribed. Treatment duration can range from several weeks to a few months, depending on severity. Persistence and adherence to the treatment plan are essential for successful outcomes. Duration and prognosis. Early diagnosis and intervention generally lead to better outcomes. Chronic or long-standing infections may take longer to resolve and require more intensive treatment. Prevention tips. To reduce the risk of fungal nail infections, keep nails clean and dry. Wear protective footwear in communal areas. Avoid sharing nail tools or towels. Address foot or nail injuries promptly. Avoid prolonged use of artificial nails. Monitor nail health if you have an underlying medical condition. When to seek professional help. If symptoms persist, spread, or worsen despite self-care measures, it is advisable to consult a healthcare professional. Prompt evaluation can help determine the appropriate treatment and prevent complications. If you're unsure whether your symptoms indicate a fungal infection, consider booking a consultation for a proper assessment and treatment plan.